So this is me. Hi. Welcome to dialysis. I am a dialysis patient. This is our dialysis machine that we have here at our dialysis unit. And currently right now I'm connected to the machine. These tubes are actually connected in my chest. And there's two tubes. One is the arterial side, one is the venous side. So what's happening is the blood's coming out of the arterial side from my body, and it's going through all these tubes and into this chamber and through this pump. And this pump helps increase the blood flow, so how fast the blood's actually going through my body or coming out of my body, and how fast the blood's being cleaned. So that's what dialysis is for. It's for patients who don't have kidney function anymore, who need their blood cleaned and any excess fluid, because we don't pee really anymore, removed out of our body that's sort of in limbo in our body. It could be around our heart, it could be anywhere. So this machine helps take care of that. So when it gets pumped into the machine here, it goes through the chambers into this is our actual kidney. This is my artificial kidney. And it actually works just like a normal kidney would, except it's obviously not attached to your body. If you look closely, you can see there's all kinds of little fibers in here. And these fibers actually help filter out any toxins that are in your bloodstream, just like your kidney would, because your kidney actually has little tiny microfibers inside of it. Obviously, they're not artificial, but God meant them to be there. But this one here is great because, if it wasn't for dialysis, I wouldn't be alive. So I definitely am grateful and appreciative for it. So the blood goes through this it's actually called a dialyzer, and it filters out all the toxins, and it returns the blood back to the chamber, and then through this venous side here, it comes back into me. So you can see it's a pretty amazing technology. Like I said, if you can't live without your kidney function, so this is what the alternative is. Thank God there's an option, is to be on dialysis. So the machine will tell you I have an hour and 22 minutes left. It'll tell you right now there's 360 mils of blood being pumped through my body, so the blood flow is about 410. I don't know if you can see that there or not. And this just tells me how the blood's going through the venous and arterial side. So that's the arterial, this is the venous. So it's spazzing a little right now, doesn't like what I just did. So, okay. And it tells you what my blood pressure is, what my pulse is, all that kind of fun stuff. Okay, so that's the exciting part of dialysis, aside from the fact, of course, it's keeping me alive. Now, the reason why I'm making this video and this campaign is because we're trying to raise awareness not only for dialysis, but how, I guess, as a dialysis patient, we really need some help. We need help making people more aware of dialysis itself, and we need help with, I guess, improving our quality of life. It's definitely difficult sitting in a chair like this or actually this one right across from me. I'm in a room right now that's private. Normally I'm in a main unit with a bunch of people, but sometimes we get stuck in these little rooms. That's actually the dialysis machine there. It's pretty big. It's about 400 pounds, I think. And this is what the dialysis chair looks like right here. Well, that's what an average dialysis chair looks like. Now, the one that I'm sitting in is the reason for this campaign. We're really trying to, like I said, increase the quality of our life, and by doing that, we need to get more physical. We need to have more physical activity in our lives and, release those endorphins that you release by doing physical activity like working out. But being a dialysis patient, it's challenging to make the time to actually work out. As well as just because you're doing it so frequently. Like for myself, I actually go for dialysis 5 days a week, between 2.5, 3 hours at a time, depending, I guess, on how I feel that day. So the reason for this campaign, like I said, is to raise awareness for dialysis, as well as, like I said, to really help improve the quality of our lives by increasing our physical activity and building stronger muscles in our heart and our bodies. So this is actually the dialysis bike. We don't actually own this bike yet. This bike is a loaner. So it looks just like that chair, but this part here is missing. And that's why I have the bike part. So you can see this bike is actually attached here. And it can be unattached and removed off so that I can put the legs up just like that one. Alright, so it can be comfortable as well. So you only really have to pedal for maybe an hour to get the full benefits of dialysis. And an average dialysis session is about 4 hours long, so that's plenty of time to do that. I mean, you can do segments of 15 minutes every hour, and you would still get the great benefits of it. Okay, so the reason why being on a bike is so beneficial is because, well, many reasons. The first really important thing, though, is that this pump here on the machine pumps this much blood. Blood flow right now is about 410 mils a minute, okay? Which is great, because the faster the blood pumps, the more blood's going to be cleaned through my body. So that means that I'll have better clearances, I'll feel better, and I'll have somewhat good kidney function, which will keep me alive longer. Now, by pedaling right now, and I'll show you, I'm not going to overexert myself in any way by pedaling and talking at the same time. And my blood pressure and pulse is monitored on this machine, so I can check it at any point if I'm ever concerned about how I'm doing. And I also have constant check-ins with the nurse. Like, they come in and they assess like what my blood pressure is and my pulse and what my levels were and how much blood was taken off and etc. So there's no worry there. So the faster that I pump here, or my legs, to the machine, like I said, your blood's going to get pumped faster because you're pumping your own blood that much faster. Therefore, more blood's being cleaned. Now, it doesn't show on here how much blood's being cleaned by me being on the bike, but when my blood clearances come back from the blood work they do each week, it will actually show on there that I'll have better clearances. And a normal dialysis patient wants at least, well, I would say probably about 75% would be great, or more, clearances, because when we do dialysis, we only have, this only gives us 20% kidney function. You know what I mean? So that may not seem like much, because it's not much. But it's enough to keep us alive, which is great. So that's why the importance of the spikes are huge. Another great benefit, obviously, it's going to build our cardiovascular endurance. It's going to build muscle tone, muscle strength. It's going to improve the quality of our life because, when you work out and you feel better, then you have that much more energy. And that's one thing that dialysis patients lack of. And it's probably because they're sitting around not doing much most of the time. So, being in a chair like that for 4 hours, 3 times a week, is not necessarily going to do anything for your muscle. It's going to, the old saying, if you don't use it, you lose it. Well, rightfully so. So we're trying to prevent that. So these bikes are about $6,300 for this chair and this bike. And we don't really have the funding for it. So that's why we're reaching out to see how much we can actually raise and how many more bikes we can actually get here. Because there's another patient and myself who are working in this program to try to raise awareness and to get these bikes going. And like I said, it's very expensive to have these bikes. We don't have the funding for it in the hospital. And I'd really like to see more bikes come in. As well as, this is just a loaner. The company that we buy those chairs from lent us this chair to try it out. So we'd like to at least own one if possible. So, if you can't help financially, it would be a great help if you could just pass this message on to anyone you know that might also be interested or be able to raise awareness. So I just want to thank you for taking the time to watch this video, and take care.